Among 111,100 participants over about that 3-year period, almost 17,000 developed low back pain, 15%. That's not a little. That's quite a lot. And it's just as the highlight said, when they put it through their analyses, in addition to obesity, abdominal obesity being an elevated risk factor. So just metabolic syndrome alone, which essentially is things that affect your metabolism. It's metabolic syndrome. So we've got different blood markers. We've got different physical markers like that midline obesity. We've got prediabetes. We essentially have all of these things wrapped into, you're getting into a state of, it's not disease, but you're not as healthy as we frankly want you to be for where you're at in life. So this metabolic syndrome really kicks up. So, hey, I'm pre-diabetic. Maybe not fully yet, but you know what? You're on your way. I've got a little extra in the tummy. Well, okay. You maybe not have full-on morbid obesity, but we shouldn't be carrying around that much. And now we have data to really show that when we add these things together, it's increasing our risk for developing low back pain. And now, since this is really centered around metabolic syndrome, not all incidences of low back pain have a mechanical dominating source, which is really highlighted by this study. This is metabolic, chemical, physiological mechanisms, things that will increase the chances of you developing low back pain. So it's not that I can therefore, just brace my core and do all of these physical things to make sure that I'm reducing my incidence of low back pain.